Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, Pasig City vows to extend financial aid to residents not included in the government subsidy program. And how soon can the city launch its own COVID-19 mass testing drive? Mayor Vico Sotto joins us live. On his third report to the nation, President Rodrigo Duterte says the Luzon-wide quarantine may be lifted if an antibody medicine against the coronavirus becomes available. And later, we find out how plasma donations from recovered COVID patients can help save lives. Experts from St. Luke's Medical Center will tell us more. President Rodrigo Duterte says he will lift the Luzon-wide community quarantine once an antibody medicine for COVID-19 becomes available in the country. In his third report to the nation Monday night, Mr. Duterte says a foreign medical company has developed an antibody medicine against the virus and is ready to roll this out soon in the market. Here's the president in his own words.
Sabi, by May, baka they would start to market it, pabili na nila. Ang problema, sabi nga ni, we are on the last ladder. Ang muna niyan yung mga mayaman na, kasi marami yan kailangan. Kung meron na yan, tapos makita ko na ginagamit ng tao, ililift ko. Total, kung magkasakit kayo, may antibodies naman tayo mabili. Ngayon, kung wala kang mabili, problema mo na yan kasi tapos na yung I will lift the quarantine.
The Pasig City government is reaching out to more of its residents. In a virtual briefing on Sunday, the local government unit says that they will give out a subsidy to thousands of families who are not covered by the national government's social amelioration program. How much will the Pasig government give out under its subsidy program, and where will they get the money? Let's go straight to the source of the story. We have Pasig City Mayor Vico Sotto. Mayor, welcome to the show. Thank you for your time.
Magandang umaga po, Ms. Pinky.
All right, sir. 206,000 families in Pasig are supposed to be eligible for government social amelioration program. However, it seems only 93,000 will be getting this cash assistance. That leaves you a balance of about 100,000 families or so. But you're saying to your residents, do not worry, the government will come in, we will take care of you. Mayor, how much money are you allotting for these 100 or so thousand families, and how much will they be getting each?
Tama po, Ms. Pinky. Actually, the 206,000 that you mentioned was the original number that was supposed to be covered by the DSWD Social Amelioration Program. Ngayon po na-approve 93,000, but I just want to clarify, yung total na bilang ng mga pamilya dito sa Pasig, hindi lang po 206,000. It's actually above 300,000 in our last count noong December. So ang nangangailangan po ng tulong doon would be approximately 250 to 260,000 families. We don't have the exact number yet. So ang ginawa po namin, dahil 93,000 lang po yung naaprubahan ng DOF and DSWD, while we're of course we're very thankful for that, and napakalaking tulong na rin po yun para sa amin. Pero hindi natin pwede kalimutan din yung mga ibang pamilya na hindi sakop nitong 93,000 mula sa SAP. Kaya po gumawa po kami, kasama po ang sanggunian panlungsod namin, gumawa po kami ng Pasig Supplemental SAP. And then naghanap po kami ng pondo over the weekend. What I was doing with my team, tiningnan namin yung cash position ng city. We looked what projects we could cancel for now, especially infrastructure projects, what we could delay, and then we also looked into our bank accounts kung ano yung mga uh, naka naka-imbak na pera sa bangko, and then we identified around 1.5 billion pesos that we can use for cash assistance for this Pasig supplemental SAP program.
Doon sa 1.5 billion, Mayor, na nahanap ninyo, more or less, doon sa natirang nangangailangan ng mga kababayan nyo dyan or constituents nyo dyan sa Pasig, how much will they be getting? Because we understand, of course, the families coming from the DSWD list will be getting about 8,000 pesos each for 2 months. So technically, that's 16,000 for the months of April and May.
Right. So kung kumulang 260,000 ng pamilya na nangangailangan ng tulong, 93,000 yung sagot na ng DSWD sa pamamagitan ng Social Amelioration Program. That leaves us with around 150,000 families. Kung i-multiply po natin yan by around 8,000 pesos, that would be, I don't have the exact numbers now, pero siguro mga 1.3, above 1 billion pesos po yan. So yung na-identify namin na 1.5 billion, makakapagbigay po kami ng 8,000 pesos per family. Of course, given the approval of our Sangguniang Panlungsod, which will have a special session this week.
Okay. So parang nga lumalabas, Mayor, ang tatanggapin nila is 8,000, possibly, no, Mayor, for the month of April and the month of May. Kumbaga parang kalahati lamang dun sa matatanggap nung mga pasok sa SAP na listahan ng DSWD.
Correct. Pero ang gagawin po namin ay one time na po
What
ito.
are the kinds of projects?
I'm sorry?
Okay. One time na 8,000 pesos. Sorry, sir, there's a little bit of a delay in our audio. So I get it, sir. 8,000 pesos pero one time lamang ang bigay ninyo. I wanted to find out what kind of projects, sir, are you letting go of because kailangan nyo pong makalap itong o makuha itong 1 billion pesos? Or how important are these projects?
We made sure that we would scrap yung mga maliliit lang na project. So, 1 million here, 2 million there. Halimbawa po yung sa, siguro hindi na akong bigay na example kasi maliliit medyo marami. So yung mga iba, mga rehabilitation ng kalsada, pwede naman siguro ipagpaliban na natin sa susunod na taon yun.
Mayor, can I get an update doon sa pasok sa listahan ng DSWD? Because I understand, sir, that government has given 100 billion to DSWD para po ipamahagi ito dito sa 18 million families. Sir, ang lumalabas ho sa aking interview yesterday, only 9 million families out of the 18 million families ang mabibigyan itong linggong ito. At the end of the week, they're hoping to finish 9 million. And at the end, by April 25, they're hoping matapos po itong 18 million. Doon po sa mga kababayan mo, sa constituents mo, Mayor, meron na ho ba silang natanggap dito sa Social Amelioration Program?
Right now, the fund itself has been downloaded to us for the 93,000 families. However, tapos na rin namin i-print yung forms kasi kami po yung nag-print ng forms. Naantay na lang po namin yung final approved list mula sa DSWD National para po makapagsimula na kami sa distribution.
In other words, wala pa pong naibibigay?
Wala pa ho. Kasi yung pera na sa amin na, pero yung approved list ay fina-finalize pa lang po.
Apa.
O inaantay po namin na ma-transmit sa amin.
You know, Mayor, I hear the problems no nung ilan nating mga kababayan. Hindi lang yung low-income families, gayon din yung mga nasa SMEs, MSMEs, sir. How important is it, sir, na maibigay na, maibahagi sa kanila ito pong 8,000 pesos dahil marami ho sa mga kababayan natin ay nahihirapan na?
Opo, Ms. Pinky, ito po kasing crisis na ito. Of course, yung health aspect is the most important that we address. Pero hindi lang po ito health crisis. Ito rin po ay isang socio-economic crisis. Kaya kailangan po ay para hindi mag-come to a standstill yung ekonomiya natin now during community quarantine and even after community quarantine, we need to make sure that our people have money to spend Kung hindi, lalaki po ang crisis even after quarantine. So with the national government, the local government of Pasig will do everything that it can to make sure that our constituents have some degree of liquidity.
All right. I want to get an update, Mayor, on your COVID positive patients. If you can give us the data. Gayon din po yung inyong PUI at PUM.
Sa ngayon po ay ang confirmed cases namin 196 confirmed cases, so with roughly 20 deaths, a little over 20 deaths. Yung POI, POM, I understand the DOH parang nagbago yata ng terminology, pero yung dating tinatawag na PUI, meron po kaming nasa 192. Yung under monitoring ay nasa mga 40 po. So ngayon, ang ginagawa po namin, mas aggressive na po yung testing. We had a new partnership with the medical, well, not a new partnership, but we have a partnership with the medical city, and they have committed to helping us out with the tests. So combined with the tests that we do with, that we send to our ITM, dadami na po to around 50 to 60 per day yung matetest po namin dito sa Pasig every day.
50 to 60 people ang maitetest sa Pasig. I just need to repeat that, Mayor.
Starting this week po, abot na po ng 50 to 60. Previously, mga 20 lang po natetest namin per day. So ngayon ho, sa tulungan po namin ng Medical City, kasi naaprobahan na rin po yung laboratory nila for testing, similar to what Valenzuela is doing also with the Medical City also, mas marami na po kaming maitetest. So at the very least, yung mga PUIs po namin, yung mga suspected cases po natin, matetest na po lahat. And then we will go kung hanggang saan kaya dun sa parang pinaka-web ng contact tracing. Hanggang saan po kaya, itetest lang namin ng itetest.
Okay. Help us run through the process, Mayor, no? Because palagi po na pag-uusapan itong mass testing. In fact, sa gobyerno also, tinatanong pa paano ba itong mass testing. Cabinet Secretary Carla Nograles was saying yesterday that ang ima-mass test, especially ngayon, yung pong dadalhin na sa mga quarantine facilities. Sir, sa inyo po, dyan sa Pasig, please tell us, sino ho bang eligible for testing na mapapasok po dito sa 50 tests a day in partnership with the medical city?
Yes, actually, I've been very hesitant to use the word mass testing, although that's what it is. Dahil minsan nagkakaroon po ng misconception ang mga kababayan natin. What we really mean when we say we're going to ramp up testing is that first, we will test everyone who is suspected, everyone showing symptoms. And then second, we will test those frontliners, yung mga healthcare workers po natin. And then third, let's test as much as we can. Doon nga po sa web natin ng contact tracing, starting from yung positive palabas ng palabas hanggang sa yung mga persons under monitoring natin. And then that's when we test other people once we finished those kung sino yung dapat i-test na una.
I understand, sir. Parang nag-e-expand po siya from the core. All right. Kamusta po yung inyong quarantine facility dyan sa Pasig? Just an update, sir.
Right. So our quarantine facility here in Pasig is a motel that was converted. Hindi pa naman siya puno, but we're at the same time ayaw natin hintayin na mapuno siya bago tayo maghanap ng iba. Depending on the size of the families that are using the quarantine facility, we can house up to around 200, max 300 people in that quarantine facility. Ngayon, hindi naman natin hihintayin na mapuno yun. We're already identifying other quarantine facilities, and I'll give the people an update siguro later on pag final na po lahat.
Okay. All right. Very quickly also, sir, because importante din po yung cremation. Just two last questions, if you will, sir. Meron ho ba kayong naririnig na problema sa mga ospital dyan sa Pasig in terms of the capacity of the morgues in the hospital? And number two, sir, I understand that you already are in partnership with, I believe, Evergreen crematorium for para po sa mamamatay, unfortunately, magkakaroon po ng free cremation. Tama ho ba?
Yes, every COVID-related death, whether positive or suspected, the city has been shouldering the cremation. No? So sagot na ng lokal na pamahalaan ng Pasig yung kremasyon nila. Ngayon po, pagdating po sa mga ospital, aminin po natin na talagang near saturation point or near capacity niya talaga yung mga ospital natin. Kaya po dito sa Pasig, ang ginawa po namin, since dalawa yung city-run hospital, and then merong DOH hospital, so balit tatlo po yung public hospital natin sa Pasig. Yung isa po doon, na city hospital, yung Pasig City Children's Hospital, kinonvert po namin into a COVID referral center. The reason why we did this is so that we can increase the capacity of our public healthcare system in accepting COVID-positive patients, while at the same time, hindi naman natin mapabayaan yung mga ibang sakit o yung ibang pasyente. Kaya hindi naman po tumitigil ang cancer, hindi po tumitigil ang heart failure. So may mga iba pa pong sakit na dahil po nasa capacity na tayo dahil sa COVID-19, medyo nasa-sacrifice po yung serbisyo sa iba. So with this referral center na Pasig City Children's Hospital, the PCGH or our general hospital will be able to revert back to or go back to its general hospital status na lahat ng ibang sakit doon po, and then we will be able to become more efficient pati po yung sa use of PPEs, bababa po yung numbers na kailangan natin gamitin at mas magiging efficient po yung public healthcare system natin dito sa Pasig.
Mayor Vico Sotto, sir, maraming salamat po sa inyong oras.
Maraming salamat po, Ms. Pinky. Ingat po.
Kayo din, sir. It's a pay it forward gesture. Patients who recovered from COVID-19 are helping others get better. Later in the program, find out why their blood donation may just help find a cure for the virus. This is The Source on CNN Philippines. We'll be right back. Welcome back to the program. The total cases of COVID-19, or the total number of COVID-19 cases in the country is nearing 5,000. 284 new cases today add to the list. Meanwhile, the death toll topped 300 with 18 more patients succumbing to the virus. But some good news, 45 others got well. Total recoveries are now at 242. During the COVID-19 pandemic, we are reminded again and again that we need to flatten the curve. What is the curve? And why are health officials saying we need to flatten it? Our Ria Trillo explains.
The term flatten the curve comes from a 2007 paper prepared by U.S. health officials from the Centers for Disease Control and Prevention, or CDC. It was a preview of a possible pandemic like COVID-19 and what needs to be done to mitigate its impact. On page 18 of the study was this diagram. The y-axis, or the vertical line, shows the daily number of infections. The x-axis, or the horizontal line, refers to the number of days since the first case was detected. The first curve shows a sharp increase in the number of people getting sick in a pandemic when governments don't introduce preventive measures such as quarantines, lockdowns, or social distancing. The peak represents the skyrocketing number of infected people. With a significant number of the population sick or dying from the pandemic, the healthcare system is overwhelmed. As a result, hospitals are unable to care for all the patients. As the virus attacks the majority of the population or kills a significant number, the virus runs out of hosts, so infections also drop significantly. But by then, so much damage has been done. The second curve has a flatter slope. That's the ideal scenario. It shows a more gradual rate of infection over a longer period of time. Health officials say this can only happen if steps are taken to prevent or slow down the spread of a disease. Last February 28th, an American pandemic preparedness trainer tweeted a slightly adjusted version of the graph. To help everyone understand the situation better, Dr. Drew Harris added a dotted line across the graph, which represents the capacity of the healthcare system. With proper intervention, the curve is flattened as the number of infections are kept below the dotted line. The healthcare system is not overwhelmed. all patients are given proper care and more lives are saved. That updated graph went viral on Twitter and is now being used by many people around the world to explain what flatten the curve means.
The reason for flattening the curve is that it buys you time, and time is the most precious commodity that you can have so you can identify those who are sick with the disease.
So yes, we do need to do our part to help flatten the curve by staying home, observing social distancing, and practicing good hygiene. That way, we can stop the spread of the disease, and healthcare systems around the world are better able to manage coronavirus cases. Ria Tanwat Cotrillo, CNN Philippines.
Up next, blood from recovered COVID-19 patients is proving vital in the fight against the disease. Later, two doctors in the front lines tell us why plasma of these people may be key in helping others get better. You're watching The Source on CNN Philippines. Please stay tuned. Patients that recovered from COVID-19 are helping out in the country's fight against the virus. Some of them are heeding the call to donate their plasma in the hope of saving others infected by the disease. Among those who donated blood is Senator Sonny Angara. He was discharged from the hospital less than 10 days ago. What makes their blood valuable in the battle against the disease? Let's go straight to the sources of the story. Hematologist Dr. Francisco Lopez and pulmonologist Dr. May Campomanes of St. Luke's Medical Center. Doctors, welcome to the show. I'm going to ask the first question already. Please feel free to answer who may be the best person to do so. So recovered patients can actually donate, can be instrumental in helping severely ill COVID patients. It's a process, I believe, called convalescent plasma. Can you please explain to us in layman's terms what convalescent plasma is?
Hi, Pinky. Good morning. When a COVID-19 patient recovers, they develop antibodies, and these antibodies are the ones that help fight the infection, and these are the antibodies that give the immunity to the patient. Now, when we collect the plasma, or the fluid portion of the blood is called the plasma, as there you can see in the screen. That is going to be with antibodies, and that is what we call now the convalescent plasma. So it's a kind of passive therapy, because it's antibodies. That's the plasma contains the antibodies.
So plasma is actually the liquid from the blood?
Yes. So when one donates blood, we can separate the liquid portion, and that is the plasma, and the remaining component is what we call the packed red blood cell, which can be used also to transfuse. Now, as you can see in the video, there fluid is the plasma.
Dr. Lopez? I'm not sure if I'm not hearing Dr. Lopez on the line. Is Dr. Lopez still on air? All right, let's go to Dr. Campomanes. Doctor, maybe you can continue on from what Dr. Lopez was saying. I think we've lost him on the line.
Hi.
Dr. Lopez, you're back. All right. Okay, both. So, balikan lang po natin. Sabi niyo po, the process that you were showing a while ago was you separate the blood from the other. Please go ahead. I can't explain it.
Yeah. So there are two ways of donating. One is by donating your blood, or what we call the threshold blood. And from that, you can separate the plasma from the other component, which is the red cell. But what we do is we use this machine called the apheresis machine, as you can see now in the video, and that will just collect the plasma. As you can see in the video now, you see that bag that has a clear yellow fluid, and that is a bag rich with antibodies and the plasma. and we usually collect 500 cc's from the donor. It's a painless procedure. It can take around an hour or less than an hour to collect the plasma. And after 14 days, the can again donate.
So it's about 1 hour.
Roughly.
Go ahead.
A little bit less sometimes.
Sorry, sir.
1 hour.
More or less. And then you said something about 14 days, Dr. Lopez. What was that?
So after 14 days, the donor can donate again if the donor wishes to.
Ah, I see. Dr. Campomanes, how effective is this? Because I heard from an official yesterday that this is on its early phase, but I also understand that such convalescent plasma has been done in the past as well.
Yes, Pinky, that is true. In the past, convalescent plasma has been administered in various infections like SARS-CoV, the Ebola virus infection, and MERS-CoV, and it has been able to produce some effect in addition to the other regimen that has been administered to these patients. Now, for COVID-19, of course, it has been done in China, and this was a case series on 5 patients published in the JAMA, and they were able to also document improvement in 4 out of 5 patients, and the improvements came in the form of symptom resolution, getting off the machine, administration of the plasma, as well as a drop in the blood parameters that would be indicative of inflammation that is part and parcel of this infection. So recovery was seen in these patients with COVID-19 and administered with CP or plasma in as early as 7 to 13 days and even as long as 37 days post administration of the plasma. So we have just started, Pinky, over the weekend. Quite soon to tell you good results. I think Francis and I and the team probably would not like to give you false. Are seeing improvements, some improvements, though very small, but there are improvements in terms of the lab parameters as well as the oxygenation status of these patients. We'll just have to be patient and wait and see. Of course, many come into consideration when it comes to observing improvements in the patient.
So much still to talk about on this convalescent plasma, Dr. Lopez and Dr. Campomanes. We're going to have first to say goodbye to our audience on television, but we will continue this discussion on Facebook, and hopefully we will try to have a better communication with the 2 doctors over there at St. Luke's, because at times we were actually missing some of the parts you were both saying. But in the meantime, I'd like to thank everyone for joining us here on The Source. I'm Pinky Webb.